great sports analogy, I hate to do this, but the university president and the athletic director decide you're not the right coach for this team, then it's probably time to say goodbye and we need a new coach. Would you agree that certainly you're going in a different direction philosophically than Secretary Kennedy is?
So I will stand behind scientific integrity with every decision I ever make. If I am put in a position of having to say, I will cede the scientific integrity to retain my job, then I am not the right person for the position. I believe that we must have science and evidence to support the best decisions for our children and others who would benefit from vaccines.
So I think here's the biggest difference in philosophy that I see, is that I think the CDC is the cause of vaccine hesitancy, that you are the problem, that because of COVID and you're forcing these vaccines on people that weren't ever really proven or justified, that the benefits didn't outweigh the risk, and you all sat there with your hands in your pockets and you let that happen. And then you let this hepatitis vaccine be at 1 day of age, be forced upon everybody. And all of a sudden, the moms and the grandmas never trust you because you're trying to force a vaccine that's not necessary at day one. If you're going into nursing school, medical school, absolutely, you should consider that hepatitis vaccine. But basically what the CDC does is act like a mandate. And you force doctors that don't agree with you to kick patients out of their clinics because they don't want their child to be exposed to a vaccine that was approved after just like 140 patients took it, being followed up for 5 days. It just makes no sense to me that every person needs every vaccine. But regardless, some of the vaccines have done incredible work. They are a miracle. They've done a great job. The basic vaccines that we got in the 60s and 70s, polio, MMR, DTaP, those seem to be great vaccines that have told the test of time. But your attitude here that every person needs every vaccine is completely contrary to Secretary Kennedy's philosophy and the mission of the president. Thank you.
So, as announced earlier, we will stand in recess subject to the calling of the chair. I expect it'll be about 15 minutes. We ask the members of the audience to stay in your seats so the witnesses can retreat to the holding room. We'll be back.
some of the things that he was talking about were clearly not aligned with the scientific evidence that I knew related to safety and efficacy and placebo-controlled trials. And the conversation seemed to change points very quickly. Okay. It was hard sometimes to follow the logic that he was putting forward. And again, he was very, very upset and very animated.
Thank you. And Mr. Chair, if I could, I have a yes or no question, and then we will be done. You said that the Secretary spoke at length about the CDC. During that time, did he ever express condolences for the police officer who was killed during the recent shooting at the CDC or the 2 children who died of measles this year?
During that meeting, no.
Thank you. Thank you, Mr. Chair.
Thank you, Mr. Chairman. Dr. Monarez, you and I spoke, I guess, a little over a month ago in my office, and we talked about trust, and that was really my number one concern, because President Trump was elected by the American people to make change. Mm-hmm. And our healthcare system during COVID, there was a lot of things that were exposed. Mm-hmm. CDC was one of them. We were looking for somebody that could run the CDC for change and get the trust back of the American people. Do you agree or disagree that the CDC director reports to the HHS secretary?
The CDC director does report to the HHS secretary.
Yeah. Do you believe that President Trump has the right and the authority to pick his cabinet?
He does.
Okay. After you were nominated, what kind of conversations did you have with Secretary Kennedy before your confirmation, or was there any?
Between the nomination and the confirmation, I don't recall any engagement.
What about before your nomination period?
We did have some conversations, yes.
Yeah. Very positive, I hope.
He was excited about my priorities: restoring trust, transforming public health infrastructure, modernizing the agency, preparing for the next pandemic. We had some productive engagements about the technological innovations that I wanted to bring to CDC. I was enthusiastic, and I believe he was as well. So
the problem I have here is probably this conversation should have been maybe a little bit more private of after all this. That's how I handled all mine, if people were let go, back when I had some kind of control over a situation. But that being said, it's hard to explain, here, to find out who's telling the truth, because there's a lot of discrepancies on both sides after Secretary Kennedy and now you here today. The American people want bureaucrats to understand you're not elected. We didn't elect you. We want you to do your job, okay? And I think you agree with that. America needs better than this at the end of the day. Mm-hmm. And so I'm gonna ask you some questions here. And, did you tell the secretary you were untrustworthy?
He asked me. He didn't ask me. He told me he could not trust me. He told me he could not trust me because I had shared information related to our conversation beyond his staff. I told him, if you cannot trust me, then you can fire me.
Okay. Did you remove or work to actively undermine political leadership appointed by President Trump?
I don't believe so.
Anybody in the CDC? Nobody? Did you remove? Once you got into office, was anybody removed?
No one was
fired?
removed.
Were they changed positions?
There were no political appointees that I changed positions.
Okay. Did you refuse to update the CDC website despite being instructed to do so, including things from the CDC website like birthing people, health equity, a policy that came down from the President of the United States? Did you refuse to do that?
No.
Not whatsoever?
I did not refuse to do that.
Okay. That's all I got, Mr. Chairman.
Thank you. And I ask unanimous consent to enter the following, which has come out while we have been in this meeting. from the Washington Post. In an August 19th email to Monarez, Matthew Buckham, Chief of Staff at the Department of Health and Human Services, wrote, quote, "I want to elevate the absolute need for political review of major policy decisions at CDC." By the way, this email was to Dr. Monarez. He added that Kennedy's office and CDC political leadership should, quote, "have eyes on the decisions for approval changes before they go into effect." And I will enter that into the record without objection. Senator Murphy.
Thank you very much, Mr. Chairman. First, I just want to understand how unprecedented this moment is and how unprecedented these changes are that are compromising our families and our kids' safety. Just some simple yes and no questions. I think they're yes and no questions. Dr. Monarez, is there any precedent for a new administration dismissing the entirety of the Vaccine Advisory Board and appointing a totally new board?
I have not had any awareness of that happening previously.
Is there any precedent for the CDC director being required to clear personnel and policy decisions with political staff in the way that you were requested?
That has never been my experience.
And is there any precedent for a CDC director to be asked to pre-approve vaccine recommendations without ever having actually seen the recommendations themselves or the medical and scientific evidence backing them up?
I have never experienced that.
You stated in a previous answer to a question that during your August 25th meeting, the secretary referenced that he had spoken to President Trump about his feelings about the childhood vaccine schedule. You testified that he had previewed for you that there were going to be some significant changes coming. Did he give you the impression that the president supported the changes that he was going to be pushing on the child vaccine schedule?
That was the impression that I got. I have no way to substantiate whether the veracity of that.
Your op-ed opens with a harrowing account of the August 8th shooting, and clearly both you, the entire leadership, and the entire building is still reeling from that moment. 180 rounds being fired into the CDC. What a traumatizing event. I want to ask you about your fears. And Dr. Horry, be glad to hear your thoughts as well, for the safety of our personnel at the CDC and the medical profession writ large. If more and more people believe that those that are recommending vaccines for our children and our families are hurting people, clearly you have to be unhinged to take a gun and fire it into a medical building. But these conspiracy theories about vaccines and about the people who are recommending vaccines, I fear they come with consequences. Do you fear for the safety of the CDC and of medical personnel if these beliefs about the CDC actually recommending things that hurt people continue to become mainstream?
I do worry about that. I myself was subject to threats, and I am very concerned that the further promulgation of misleading information will undermine not just the safety and health of our children, but it will also exacerbate some of these tensions, the willingness to commit harm if someone is affronted by a belief that the people like us that are trying to help them are actually not trying to help them.
And I would just say it was 500 rounds. It was 180 that hit the building.
180 hit the building.
Now, each bullet was meant for a person. And each of my staff were very traumatized afterwards. I had staff that were covering their kids in the daycare parking lot. There were people that were out at the ride share as bullets were passing over their head. I have many that won't speak about vaccines now and have removed their names off of papers. They don't wish to present publicly anymore because they feel they were personally targeted because of misinformation.
So you know of personnel who now will not put their name behind good science.
Correct.
That they know would protect the health and safety of families and children because of their fear of violence.
Correct, and even at the ACIP meeting, you'll notice we don't have our subject matter experts presenting anymore. It's taken up to a leadership level because we did that to protect our staff and scientists so that they would be disconnected and their names not associated so that they won't be targeted.
Thank you both for your candor today and your service to the country.
Senator Banks.
Dr. Monarez, I understand you have retained attorneys to dispute your firing. Is that correct? I believe they're with you today.
Not to dispute the firing, I have been fired. They're here to help me prepare for this, to make sure that I was in a position to be able to communicate effectively what transpired.
So their purpose is to support you just for today, or is there another purpose that those attorneys
They have been
have
supporting
for you?
They have been supporting me since knowing that there was so much complexity associated with what happened.
I'm curious, did Mark Zaid connect with you, or did you reach out to him?
I believe
How did you connect with him?
I was given his contact information.
He didn't contact you?
I don't actually recall who.
You just said a moment ago that you were given his contact information. Who gave you his contact information?
I received it from a number of different individuals. I think with my termination being as abrupt as it was, people were concerned about the support structures that I would need to be able to make sure that I understood.
I just want to make this clear. He didn't reach out to you. You were given his number and you reached out to him. Is that correct? That's what you just said, is that?
I believe that is correct, although I don't have perfect.
I'm going to ask one more time. He didn't reach out to you.
I don't believe he reached out to me.
Of the thousands of lawyers that you could hire to help you through this process, why Mark Zaid?
You know, look, the moments, the hours after I had been terminated, I was concerned in a number of different facets associated with my termination. One of the things that I wanted to make sure I did was have clarity of understanding of what had transpired and what would I.
You don't seem naive at all. You have to know that Mark Zaid is a leading opponent of President Trump, notorious for his online activity that is very anti-Trump. He was heavily involved in President Trump's first impeachment. Why did you hire a guy like that, of all the thousands of attorneys? And furthermore, he advised his clients to leave the country after President Trump won the 2024 election. Why would you hire a guy like that?
So I actually was not aware of any of those details associated with Mark.
Right, he's right behind you. You brought him with you today. Notorious for his anti-Trump activity and involvement. And you hired that guy.
Yeah, so I was seeking some critical counsel to be able to help me make sure that I was understanding and aware of everything that had transpired and preparing for what might be next, including this committee hearing. Mark Zaid and I have never spoken about politics. I never asked him about his politics. He has never asked me about my politics. He is a well-credentialed counsel.
So you're claiming to be naive about Mark Zaid's political activity as he sits behind you, advising you for this hearing.
I have not
and helping you through this process.
I have not had any discussions with Mr. Zaid associated with his politics.
That's astonishing. Doctor, during your confirmation hearing, you testified about your priorities to, quote, support President Trump and Secretary Kennedy's vision of a healthier America. Those were your words. Did your priorities change along the way?
My priorities have not changed.
And when you were serving as acting CDC director and then nominated and confirmed, you obviously understood President Trump and Secretary Kennedy's priorities, the MAHA priorities. You obviously understood those. What changed along the way?
The only thing that changed was the demands that I compromise my integrity. I still support that we need to make our children healthier. I still support that we need to do all of the things I had.
You determined along the way that you weren't aligned with President Trump and Secretary Kennedy.
I did not.
Okay.
I did not. The only
Tell us
thing-
more about the conversation that you have with Secretary Kennedy about your trustworthiness.
Yep, he had become, so three things had happened.
And you denied to Senator Tuberville that you yourself told Secretary Kennedy that you are untrustworthy.
I did not say
How did you say that?
He asked me, so look, that morning, I had been clear that I was not going to fire scientists, that I was not going to commit to pre-approving vaccine recommendations without data and science. I had been very alarmed at the demands, and I had reached out as part of what I understood my obligations to communicate that to this committee. The secretary became aware of that, and in the context of those activities, he told me he could not trust me. I told him that if he could not trust me, he could fire me.
That's all I got. I yield back.
Next is Senator Hickenlooper.
Thank you, Mr. Chair. Thank both of you for being here today and for your service. Time was really valuable. Let me ask a rhetorical question. Secretary Kennedy told our colleagues on the Finance Committee about vaccine access. He said, most Americans are going to be able to get it from their pharmacy for free. Everybody can get it. But that's not true, is it?
My mom lives in Virginia, and she was unable to get it.
Great. I mean, I realize with you out of office, you don't have access to those informations, but about half of all American kids get free vaccines through the Vaccines for Children program. This is now at a standstill, waiting for guidance from the CDC. States by Colorado are trying to lead by issuing separate guidance for their states about vaccine access. Obviously, that's a lot of friction and confusion. Many insurance plans defer to federal recommendations to determine coverage of vaccines, leaving many families with bills that can range into the hundreds of dollars just for vaccines. And pharmacies across the country, from the confusion, they're not sure if they can administer the vaccine or even if they have it in stock. So I think we've got a real problem to navigate that we've got to be able to look at it. Dr. Monarez, during your tenure as CDC director, your short-lived tenure, you tried to implement guardrails to reinforce the Advisory Committee on Immunization Practices, or ACIP. Given the Secretary's actions, do you still agree that we need those guardrails?
Yeah, what I was trying to implement was what I had testified here on June 25th is transparency, accountability, and integrity to the processes. And what I had proposed